RYTHMIC is a French network dedicated to the management of patients with thymic malignancies. It started in 2012, so it's a 10 years of RYTHMIC. We are discussing the management of all patients diagnosed with thymic tumors at national virtual tumor board. So at the end, it's a kind of central organization for the decision-making of the treatment strategy for the patients. And this is linked with a systematic pathological review of all the cases, again, central pathological review, and to a database. From this database, we looked in for this study at the patients diagnosed with thymic carcinomas to have a comprehensive view of the treatment strategies, whatever was these treatment strategies. We have many data in the literature, but focusing on the surgery of early stage thymic carcinomas or the patients with metastatic tumors receiving systemic therapies. Here we wanted to look at globally the pattern of treatment for those patients, obviously based on staging and how the patients were treated. We looked at surgery, and at the end, the management of those patients was based on surgery for about 30% of the patients. The majority of cases followed by radiation therapy and possibly chemotherapy as per the current clinical practice guidelines. For patients with metastatic disease, we were able to show the sequencing of the systemic therapies. Chemotherapy in the first-line setting, mostly based on carboplatin, paclitaxel, or adriamycin, cisplatin, cyclophosphamide regimen. In the second-line setting, a majority of patients are receiving anti-oncogenic agents, sunitinib, and the one key finding was also that a majority of patients received at least 3 lines of systemic therapy. Usually those patients do not have comorbidities. These are young patients, so a sequencing of therapy in the setting of metastatic thymic carcinoma is possible. The last message is that for those patients, we recommend comprehensive genomic profiling, because in some cases we may identify oncogenic alterations that are amenable to targeted therapies, such as KIT inhibitors, such as PI3K inhibitors, and in some rare cases, BRAF inhibitors.